I'm Janna Hastings. I'm a computer scientist and psychologist, so I bring a data management perspective, but also a sort of technology perspective. So
I'm Susan Michie. I'm Professor of Health Psychology and Director of the Centre for Behaviour Change at University College London. I trained as a clinical psychologist but haven't practiced as that for many, many years. And part of why I'm involved in this project is to do with trying to define more precisely what interventions are and the context of interventions to change people's behaviour or thinking or emotion. It's a way of representing knowledge by very specifically defined what we call entities, things, and how those things are related to each other. And the reason it's helpful is that it makes it able to define things in a way that can be communicated with other people, and different types of knowledge can be brought together in terms of trying to understand things.
the thing is that most systems of classification and most ways of thinking about a domain come from a specific perspective. And they have to, and there's nothing wrong with that. But what makes an ontology different is we try to figure out how can you integrate across different perspectives. How can you find common ground, represent that common ground, and make sure that that common ground matches the data and is clear that everybody can understand. And then you can still have different ways of looking at the data, different ways of looking at the research from those different perspectives. But your ontology tells you where's the common ground that you're standing on.
We've both been involved in a project which has developed an ontology of behaviour change interventions, and that has been very helpful in terms of bringing together lots of different kinds of evidence and using that evidence to be able to make predictions about outcomes by harnessing machine learning and artificial intelligence, because part of what ontologies do is give a unique identifier to every construct, this entity, or relationship between it, and so it can become computer readable. What we're doing in this project is developing a similar framework, a way of representing knowledge about mental health. We won't be, I think, using it in the same way within this project, not for the first phase anyway. But what it will enable is the evidence and the findings that we produce, be able to look at that in association with findings from other areas. So it provides a shared language, a common way of thinking about things. It doesn't mean everybody's got to use the same language. It doesn't mean everybody's got to talk about the same things. But what it does mean is that you define it in such a way that this is what I mean by this is what you mean by this, how are those two meanings related? And in that way, we can join up knowledge instead of having silos of knowledge, which unfortunately happens in all fields, including mental health.
Yeah, so exercise and sort of physical activity is something which people use very vague and broad descriptions, and then in practice that translates into a lot of different things. So people could talk about high intensity physical activity, but that could mean in a particular study that they get people to run on a treadmill, or in another study that they have to hang on some bars or something. And at the end of the day, whether or not there truly are common mechanisms across different types of physical activity is an empirical question. But this question is difficult to answer if the details are left out of the data. So we just try to we will be adding much more detailed and specific descriptions of different categories of physical activity, and we try to get the same level of detail out of the methods of the studies that are included in the systematic reviews. And then, hopefully, this sort of more detailed level description would allow us to look at the resulting data sets from different angles and ask, is it really the intensity that makes the difference, or is it something about whether the people were doing the physical activity in social groups? Is it something about the context, and so on? So you will have more possibilities by having this description which unites across the different studies the way of thinking about the categories of physical activity. So the ultimate aim is to have ontology annotated data in the repository, and this will be where most people will access the data that comes out of this whole project through this data repository, and everything, all the data in it will be attached to the ontology. But during the course of the project, as we're going, we're working with the living systematic review teams. They give us their search terms, their constructs that they're looking for, their formulation of the question, and we try and translate that into a representation in ontology, and then we discuss these representations with various different stakeholders. So there's an ongoing process of agreeing together with all the different involved people what the ontology ultimately looks like, and then there's a kind of user perspective of, oh great, this database, it's well organized, it's got some sort of, coherence across all the different studies. That's the output.
I think what taking this approach will help with is thinking about things in terms of what they actually are, what they look like, what they feel like, what people think they are, rather in terms of labels. And I think one of the problems in the field is people using labels in maybe a rather simplistic, reductionist way, and so losing nuance or complexity. There's also problems about using labels in that people can use a label to mean different things, or people can try and describe one thing but using different labels. And so if you just go with labels about things, you're really bringing confusion into the picture, and you're not in a position to get the most out of whatever knowledge there is around. So thinking in terms of defining things in terms of what they are, rather than the labels people have used, I think will help everyone. I think it will help science. I think it will help people with lived experience of mental health issues. I think it will help professionals maybe to think a little bit more clearly and a little bit more dispassionately about their work and their approach. And I think it will help communication between all these different groups.